Hello friends, so in this video we are discuss about the Alzheimer's disease. Now general term માં Alzheimer's disease માં શું થાય કે પેશન્ટ્સ ને કોઈ પણ વસ્તુ યાદ નહીં રહે કે એટલે કે ભૂલી જવાની બીમારી થઈ જાય. That is what the Alzheimer. Now the introduction of Alzheimer's disease. It is a degenerative brain disorder of unknown etiology which is the most common form of dementia. Okay. In that what happened, degenerative changes occur in the brain and there is no specific reason for that. So unknown etiology that usually start in late middle age or in the old age. Okay, basically this happen in the old age patient like in our home દાદા દાદી. Okay, so એમને આ ટાઈપનું ડિસીઝ થઈ શકે છે કે એમને આપણે ખાવાનું આપીએ એન્ડ આફ્ટર સમ ટાઈમ એ લોકો કહેશે કે મેં કશું ખાધું નથી. સો દેટ ઇઝ વોટ કે એમને ભૂલી જવાની બીમારી હોય. સો બેઝિકલી ઇટ હેપન ઇન ધી મિડલ એજ ઓર ઇન ધી ઓલ્ડ એજ. Results in progressive memory loss, impaired thinking, disorientation and changes in personality and mood. Okay, so due to brain degeneration એમને શું પ્રોબ્લેમ થશે તો એમનું પ્રોગ્રેસિવ મેમરી લોસ થશે, એમને કશું યાદ નહીં રહે અને પહેલાંનું પણ યાદ નહીં આવે. ઇમ્પેર્ડ થિંકિંગ એમની થિંકિંગ પ્રોસેસ અફેક્ટ થશે. ઓરિએન્ટેશન proper nahi rahi, so that is what disorientation and changes in the personality and the mood. There is degeneration of brain neurons, especially in the cerebral cortex, and presence of neurofibrillary tangles and plaques. Okay, plaques formation thase, and what happened, it contain the beta amyloid cells. Let's see here. The meaning of Alzheimer's disease is what basically, so it is chronic irreversible disease. We cannot cure this disease. So it is chronic and irreversible disease that affect the cells of the brain and cause impairment of intellectual functions. Alzheimer's disease is a brain disorder which gradually destroys the ability to reason, remember, imagine and learn. Okay, so this is what about the Alzheimer's disease problem, like ability to reason, ability to remember and ability to imagine and learn that destroy in the Alzheimer's patient. Now here the comparison of the normal aged brain, that is on the left side, and on the right side the brain of the Alzheimer's patient is present. Now see the differential characteristics. Okay, so here what happened, this is the normal patient brain and this is the Alzheimer's patient's brain. In that what see that is degenerative changes are present in right side. Next is about incidence. So about 3% of men and women ages 65 to 74 have chances of AD, that is Alzheimer's disease, and nearly half of those 85 and older may have the disease. The normal age is 65 to 74 and other is very old patient up to the 85 of the age, they have this type of disease. About 360,000 new cases of Alzheimer's are diagnosed each year. Next is causes. So basically it is the unknown etiology, but some factors that might implicate the disease. So that factors are, first is neurochemical factors such as acetylcholine, somatostatin, substance P and norepinephrine. These factors might be responsible for AD. Next is environmental factors such as cigarette smoking or the chronic smokers, certain infections such as bacterial or viral that might be damage to the brain. Then metals, industrial or other toxins that is harmful to our body, and use of cholesterol lowering drugs like statin drug. So these are such environmental factors responsible for AD. Third is genetic and immunological factors such as oxidized LDL receptor 1 and angiotensin 1 converting enzyme are tied to the way the brain cells bind to apolipoprotein 4 એન્ડ રિડ્યુસ બિલ્ડઅપ ઓફ હાર્મફુલ પ્રોટીન્સ કે આ જે એન્ઝાઇમ છે તે કોની સાથે બાઇન્ડ થશે APO4 સાથે અને શું કરશે જે પ્રોટીન જે છે બિલ્ડઅપ થવાના that reduce and it is known as plaques in the brain respectively. Okay, what happened? Reduce buildup of harmful proteins known as plaques and in the brain it is present. Such risk factors of Alzheimer's disease are Down syndrome, family history, chronic high blood pressure, head injuries, sometimes gender, and smoking and drinking excessively. So in that type of patient, the chances of AD are more. Next is about the pathophysiology. What exactly happened? So Alzheimer's disease attack the nerves and brain cells as well as the neurotransmitters. Okay, જે normal neurotransmitter secretion છે એ affect થશે and it attacks the nerves and the brain cells. So what happened? The destruction of these parts cause clumps of protein to form around the brain cells. આખું clump formation થશે and that clump formation is known as plaques formation or we can say it is the bundles. And the presence of that plaques and bundles એ શું કરશે ધીમે ધીમે જે connection છે between brain cells એને destroy કરવાનું start કરશે and which make the condition worse. See here, due to the etiological factors, changes occur in proteins of the nerve cells of the cerebral cortex. Then accumulation of neurofibrillary tangles or we can say plaques in the brain that cause the granulovascular degeneration that lead to loss of cholinergic nerve cells and ultimately the loss of memory, loss of function and cognition is happen. So in this diagram, here the first diagram on the left side that is the normal one and second is the Alzheimer's. So in that what a purple color one okay that shows the neurofibrillary tangles and these are plaques and these plaques શું કરશે ધીમે ધીમે જે કનેક્શન છે બ્રેન સેલ્સના એને શું કરશે ડિસ્ટ્રોય કરશે and that ultimately lead to memory loss. This is what about the exact pathology behind the Alzheimer's disease. Next we discuss about the signs. So signs are total 10 warning signs. Okay. First is memory loss. Second, difficulty to performing familiar task. Okay, जो normal daily routine में task करता हो that also difficult for AD patient. Problem with language, disorientation to time and place. કે patient ને ખબર નહીં પડશે કે શું time છે કઈ place છે કે orientation problem હશે. Fifth, poor or decreased judgment. 6 is problem with abstract thinking. 7, misplacing things. 8, changes in the mood or behavior. 9, changes in the personality. And 10 is loss of initiative. So this is what about the 10 warning signs with the patient of Alzheimer's disease. The most common signs are memory loss, disorientation and poor or decreased judgment. These are most important signs. The next is about the symptoms. So patient might feel about the confusion, disturbance in the short-term memory as well as long-term memory also affect in AD. Problems with attention and spatial orientation, personality changes, language difficulties and last is unexplained mood swing. Like अचानक patient एकदम happy થઈ જશે and अचानक sad થઈ જશે. So we can't explain that mood swings. Now about the investigation or diagnostic test are first is psychiatric assessment we can do. Second, mental status examination and neuropsychological assessment by the psychologist or the psychiatrist. Third is laboratory test. Fourth is brain imaging like CT scan, MRI, PET scan or SPECT. Other is CSF examination, then electroencephalograph, EEG and electromyogram. So these are some tests that we can do in AD diagnosis. PET scan of the brain of person with AD showing what? So it shows the loss of function in the temporal lobe. Now the management. So pharmacological or medical management, that is acetylcholine esterase inhibitors we can give. Why? So it prevents the breakdown of acetylcholine and a chemical messenger which are important for learning and memory, because the chemical production is affected. Okay, so if brain damage start, so we can give some inhibitors of acetylcholine esterase that prevent the breakdown of acetylcholine, and acetylcholine basically responsible for learning and memory, and that is important chemical messenger for that. So if we give this drug, it prevents the breakdown of acetylcholine. Such examples of these drugs are donepezil, rivastigmine, and galantamine. Next is N-methyl D-aspartate receptor antagonist, that inhibition it blocks the NMDA receptor and inhibit overstimulation by glutamate, that is what neurotransmitter. Then other drugs are antidepressants, because the Alzheimer's disease patient have anxiety, depression, mood swings, keep proper sleep nahi hoy. So in that condition we can give antidepressant drugs, anxiolytics, antipsychotic drugs, and anticonvulsants, because sometimes seizure may happen. So such drugs like phenobarbital we can give for seizure prevention. So these are some drugs that helpful in the patient with the Alzheimer's disease. Next treatment is psychosocial intervention. So first is behavioral approach. Okay, Alzheimer's disease na patient no behavior ekdam alag hase. We can't even explain in words or understand. So behavior therapy we can give emotion oriented approach like reminiscence therapy, validation therapy, supportive psychotherapy, sensory integration, stimulated presence therapy. Sensory integration we give as a physiotherapist, but this other therapy that cannot treat by us like physiotherapy, it is the different branch for these treatments like reminiscence therapy, validation therapy, and stimulated presence therapy. Supportive psychotherapy given by the psychologist as well as psychiatrist. Next is cognition oriented approach, and last is stimulation oriented approach we can give. So this is what all about the psychosocial intervention. Thanks for watching my video, and if you like my video, please share with your friends and subscribe my channel for more videos.